Hi guys, hello, welcome to another AMA session. I'm Dr. Behnam, board certified dermatologist and founder of Happy It. Welcome guys. So before we get started, uh, I just want to let you know that all the information here is does not establish any medical doctor relationship. This is for your own information.
Sorry.
I think that's perfect. Um, so welcome to another AMA session. I'm Dr. Behnam. Let me pull up our sheets here, our question sheets. Perfect. So all this information for educational purposes only and is not intended to provide any medical advice or services, and do not rely on this information to make any medical decisions. And remember to discuss the risks and benefits of any treatment options with your medical doctor before starting. So question number one, what is Dutasteride? So Dutasteride is a drug that is FDA approved for enlarged prostate in men. However, it's also being used quite a bit for hair loss in men. It's an off-label use of an FDA-approved drug, and what it is, it's very similar to the pill finasteride, which is also known as Propecia. But the difference is that finasteride inhibits one enzyme, 5-alpha reductase 2, whereas dutasteride inhibits two enzymes, 5-alpha reductase 2 and 5-alpha reductase 1. In clinical studies, it's been shown that dutasteride works better than finasteride. It has much better efficacy in restoring the hair and causing hair growth. And in a lot of those studies, but when they compared the side effects of finasteride and dutasteride, they also realized basically that the side effects profile are pretty much the same. There's also a report out of a urology journal a couple of years ago showing that dutasteride, in fact, will have a lower risk of some sexual side effects. So we are a big fan of the dutasteride. We do believe that it does give patients much better results with respect to the hair growth. How was dutasteride discovered? Again, it was discovered when patients were taking it for enlarged prostate that causes more hair growth. And again, the way it works is that DHT blocker, which means it blocks the efficacy, it blocks the conversion of testosterone to DHT. Can I start with dutasteride, or do I have to build up with finasteride first? So traditionally, we always started with finasteride, but right now, dutasteride is very widely used, and there's no reason why you can't start with dutasteride. As long as you don't have any side effects, we start with it and you continue it. Can I take oral and topical dutasteride at the same time? Yes, you can. Um, we've noticed in our studies and also with our patients that patients that do oral and topical do end up doing better. We don't necessarily always recommend starting both simultaneously at the same day. A lot of patients may start the topical first for a month and then add the oral, or vice versa. So basically, to make sure you don't have much side effects and you don't basically increase the side effects of doing both together. But yes, we do have a lot of patients that do both topical and oral test at the same time. What is the advanced formula? The advanced formula used to be the old kitchen sink formula. And what it is a combination of finasteride, dutasteride, minoxidil, renoic acid, and hydrocortisone all in one in a topical solution, and patients apply onto the scalp. Why does the advanced formula go down to 0.1% of finasteride and dutasteride, whereas usually there is 0.3? That's a great question. So in order basically to ensure safety of our patients, we decided that when we combine the finasteride and dutasteride together in one topical formulation, to reduce the percentage concentration of them to 0.1. That being said, a lot of our patients that use it still say that they get amazing results. So don't let the concentration of the finasteride and dutasteride fool you. What is minoxidil? Minoxidil, it's a vasodilator. So minoxidil was used originally years ago as an oral medication to control blood pressure, and is a vasodilator. It basically dilates the blood vessel. It reduces the blood pressure. People notice that when you use minoxidil, it actually causes hair growth on the scalp. So that's how topical minoxidil Rogaine came about in the U.S. market. recently, in the past several years, oral minoxidil has become very popular again, just because a lot of the patients don't want to go oral finasteride because of the risk of such side effects. So oral minoxidil has become very popular, and in my office, we actually use oral minoxidil quite a bit. Um, and at Happy, we still also use the minoxidil quite a bit, just because look, it has no risk of sexual side effects. It's a vasodilator, which means increases blood flow to the scalp and causes hair growth. How do I know which product or formula is right for me? That's a great question. So a lot of the formula is customized based upon the patient's age, if they're male or female, what have they used in the past, the degree of hair loss. So and our dermatologists basically make that decision. So my recommendation is get online, fill out the medical questionnaire, upload your photos, and let our dermatologist figure it out for you. Unless there's any specific one that you want to use. So, for example, we have our new liposomal formula, the super solution, and with the liposomal, it's once-day application and it feels like a lotion, and people really like it quite a bit. So if that's something that you're interested in, then please specifically state, hey, I want the liposomal formula. So the difference between the major categories of our products is that we have our traditional happy and topical, which is a solution, and so you have the topical finasteride or we have the topical dutasteride. Then we have our advanced formula, which is the combination of finasteride and dutasteride. And then we had our liposomal super solution, which is a once a day formula as opposed to twice a day. It's not a liquid, it's more of a lotion. It really doesn't have a lot of alcohol, so it's less irritating. Once a day goes on really easy. So a lot of patients love the liposomal formula, and also it's a slow release formula, which means that the risk of sexual side effects is lower because it prevents the immediate release of the finasteride or dutasteride into the body. Can you plateau with hair growth? Yes, that happens with everything. With oral medication, with topical medication, you could certainly plateau, and that's normal. And this is why we constantly, switch out the formula. We add other stuff in it, so that basically we keep reigniting the growth of your hair. I'm experiencing rapid weight loss. I noticed that my hair is thinning. What can I do to prevent this? So, yes, so we know as a fact that patients with rapid weight loss could experience shedding. It depends on multiple different things. First of all, if let's say if you're on any of they do medication like Ozempic or other ones that are similar, some of those medications do carry about a 4 to 5% risk of hair loss anyways. In addition, when you're losing a lot of weight, you're not absorbing a lot of those nutrients that you usually do, and some patients could become vitamin deficient, and that could also basically lead to hair loss. Also, some patients lose weight so fast that they go into what's called telogen effluent. It's a shock to your system. So there are three reasons why you can lose your hair when you're losing weight. So how can to prevent this? We typically basically advise not to lose weight very rapidly. And also, if you're doing that, if you do want to lose weight, we do recommend basically having the protein shakes, like whey protein, or what I like, or the Orgain vegan protein. Make a smoothie out of it, drink it every morning instead of breakfast, and that basically will replenish some of the vitamins and nutrients that you lose on a daily basis. Guys, let's talk about some application tips here. So, how do I apply my topical treatment? That's a great question. So, the topical treatment basically comes in a bottle, and basically, what you do one pump in a bottle, and usually the bottle is designed to go only halfway, and then you apply on the scalp and basically rub it onto the scalp. And then you do another pump and rub it again. So we usually recommend two pumps because every pump is about a 0.5 ml. So if you do two pumps, is equal to 1 ml, and you want to do that twice a day. Is it safe to apply the topical in the morning, take the oral midday, and at the end of the night do the topical again? Yes, a lot of people do that. As long as you don't have any side effects and you titrate up slowly, you're okay to do that. Is applying the topical once a day okay? Yes, look, a lot of patients still apply it once a day, and that's perfectly fine, and they see good results. If you do apply once a day, what you could do, three pumps and basically apply all of the scalp. How long can I take a break from treatment before seeing my results regress? That's a good question. Well, it shouldn't happen within a week or two. I mean, it usually takes several months before the results regress, but I do have some patients that tell me that they will stop for 2 weeks and they start to see some more hair loss. But typically, about a week to 10 days should be fine. Okay, guys. So is Happy Head prescription only? Yes. Happy Head is a prescription medication that you have to see a dermatologist for him to prescribe it for you. Can I wash my hair every day? You could wash it every day, but we recommend not to use a shampoo every day. We recommend use a shampoo every other day. What are in the hair supplements? The hair supplements were designed by uh, by us, Happy Head, and and our idea was that basically to incorporate enough nutrients and vitamins in it so that it could be this like the only supplement that you're going to take. So our Happy Head hair supplement includes the right amount of vitamin D, biotin, and iron, along with some collagen in it. And it's a hair vitamin. So once you take it, you don't have to supplement with any other vitamins. What is a derma roller? A derma roller is a roller that has about 540 spikes, typically at the tip. And what patients do basically after applying the medication onto your scalp, you gently roll for like 30 minutes. Don't roll continuously in the same place. Don't apply too much pressure. Don't make yourself bleed. And you constantly want to basically be moving around. How often do you use it? It depends on the depth. We usually recommend use a depth of 0.25. If you do that every day, it means fine. At that depth, you could do it every day. We do not recommend using a higher depth. Again, do not make yourself bleed. Guys, let's talk about Happy a little bit. How is Happy different from other companies? When I started Happy, my intention was to provide the best prescription topical medication to my patients. But there's one thing that I knew. I would see hair loss patients every day. And you know what? The only thing that I realized was that every patient was unique. We had some patients that had more hair loss than others. You know, some were male, some were female, some were in the menopausal, some were non-menopausal. So we realized that one size does not fit all. And this is why at Happy Head, we have so many different formulation of formulas, and they're customizable because we understand that every person is different. So this means that for you to get the medication, you have to submit basically a medical questionnaire, your photos, and our dermatologist will customize a formula just for you. And let's say if something doesn't work out, you just reach out to us, and what we're going to do is that basically we're going to adjust that formula, either take things away or add more stuff in it to make it just for you and send it out. So I want to ask you today, how's your day going? It's going great. Today's the first day of school for my son. He's finally went to first grade. We dropped him out of school and basically came here. We're having the AMA, so we're doing wonderful. Thank you for asking. So we can lower the concentrations of the ingredients based upon your needs. We have board certified dermatologists on staff, basically that review your medications. Unfortunately, with other companies, they don't have boards of dermatologists. We have boards of dermatologists that review your past medical history, your hair loss history, and based on that, basically they customize the make just for you. And if there's any questions, we will give you a call, or you can give us a call, and you can talk to one of our hair specialists. And if there's any questions, we'd love to talk to you. Let's talk about the perks again. So Happy Head, we have free shipping. We have free customization that competitors don't have. We have ongoing support basically from US-based hair loss specialists. We're based basically in LA, California. This is where our headquarters are. And everything is made in USA with top quality ingredients. One of our patients asked, my hairline is, I'm interested in getting Happy Head. My hairline has been receding for the past 2 years and it runs in the family. What do you recommend? I recommend starting with a topical product, the topical traditional Happy Head. You could do our traditional solution or the super solution, which is just once a day. You choose which one you want, and give it 6 months and see how you do. And the most important thing is to take photos. People always forget how they look like. In my office, I take photos of everyone and they come back in 6 months and we take photos again. That's really, really important. Now, how does the startup process work? It's really easy. It literally takes 5 minutes. Just get on the Happy Head website and basically just start a consultation. It takes you through a medical questionnaire. At the end, basically, you do have to upload photos. And once you do that, you're done. The information gets sent to a board of dermatologists. They'll review your questions. If there's anything, they will contact you directly. If not, they'll make a customized formula just for you, send the prescription to the pharmacy. The pharmacy will make the product for you and ship it out free of charge. So basically, all you need to do is just fill out the questionnaire and wait at home for the product to come to your house. And it comes in, and usually it's delivered within a week to 10 days. I'll order today. Thank you so much. Enjoy your day. So do we have a promo?
Yeah, don't have your
Oh, I think it's Dr. Ben. I think it's Dr. Ben 60. Yeah. So actually, use my promo code Dr. Ben 60. That's DRBN 60, and you get 60% off. How does one change the formula? It's really easy. Just go on happy.com/help, and basically just talk to one of our customer specialists, and they will change the formula. And just say, I want to change my formula. Can we use Happy on the beard area? No, we cannot use it on the beard area. And the reason is because it just has hydrocortisone. So please don't use it on the beard area. So guys, let's talk about our new products, the 3-in-1 topical super solution. So what is this? So it's topical finasteride 0.3%, finasteride 8%, finasteride 0.3% with minoxidil 8%. So what it is the liposomal formula that's a slow release and is intended to reduce some of the sexual side effects from the finasteride. And the beauty of this is that it's not a solution. It goes on really easy, and it's just once a day. That's amazing. So the way that liposomal works is that it's a slow release formula. The way you apply it is that basically you put some on your scalp and then you rub it in. It is not twice a day application. The pros is that it's a once a day. It's not liquid. It's not messy. It has a high concentration of finasteride minoxidil. What are the cons? I think it's slightly a little more expensive, but not that much. But honestly, it makes the routine much easier. And in contrast to some of our competitors that use a spray, the spray, everything gets stuck on top of your scalp. But with this, basically, you just apply it directly onto your scalp. It's a lotion. It's not very greasy and it goes on really well. How can you order it? Just get on our website, and it's called the Super Solution. And Happy the first on the market? Yes, we are the first one to have the liposomal formula on the market with a high dose of finasteride. What makes ours better? Again, as I said, once the application is not too drying, not too flaky, not too greasy, easy to use. So guys, let's talk about our account page information. So Happy is a subscription service, and you could really do like a lot of do stuff online. So if you just go to your account and basically you could just push back a subscription, cancel a subscription, or chat with them with any of our staff members. You could also adjust your frequency very easily and change your refill dates. We cater to you. We are here basically to take care of you. It really makes us happy when we know that we have thousands and thousands of patients using our product, and they're getting their hair growth back, and more importantly, they're getting their confidence back. So, and if there's any questions, please feel free to reach out to us. We have a team of hair specialists at your disposal. Literally, we have people that you could call and talk with. We have a really good customer service staff. We invest a lot of money into our team. So basically, we provide you with a concierge service. And please remember that everything is HIPAA secured, either chatting with doctors or just patient chat. Everything's HIPAA secured. So in closing, thanks so much for tuning to us today. If you're a happy fan, please make sure you give us basically on our Facebook page or on our review page and review us. We really would appreciate it. Trustpilot. Again, our team of hair specialists are here to answer any of your questions. Please go to happy.com/help, and also you could give us a call as well. Thank you for the Happy team and Genevieve for putting this together. Again, if there's any questions, feel free to reach out to us. Have a beautiful day. Bye, everyone.
Yay.